Ah, this heel is hurting. Can anyone do something about it? Let us today see what we can do regarding heel pain, plantar fasciitis or calcaneum spur. Welcome to our channel Homeopathy First. The motive of this channel is to take homeopathy to all classes and masses. Today is our topic regarding heel pain, calcaneum spur or plantar fasciitis. All these three conditions are very important to deal with, and it affects the life of the patient to certain extent that his work is hampered and there is a disability. Let us first understand what heel pain exactly is, what are its causes, what type of investigation needs to be done, and what treatment is available, and what homeopathy can do to help us to relieve this pain. So let us begin. As we can see, heel pain is usually due to the inflammation of a band which is present down in the heel. It starts from the heel and goes to the foot. So inflammation of this thick band or swelling or internal damage to this band leads to what we say as plantar fasciitis or leads to heel pain. The symptoms usually are pain early morning, not able to get up from the bed, or when the patient gets up from the bed, patient feels the severity of the pain is more, and as he moves then the pain reduces. Or if he has moved for a lot of time or exerted for a lot of time, that time the heel pain increases, or this inflammation or swelling or pain of this band which is present from heel to the toes increases, and that leads to severe pain in that part of the body. Most of the time it is unilateral or sometimes it is bilateral. Okay, so there is pain, swelling, and sometimes you might get stiffness. One more reason for additional heel pain is calcaneum spur. That means a bony growth in the downside of the heel. Again, constant plantar fasciitis can lead to calcaneum spur formation or excess of bone deposition in the heel leading to calcaneum spur. So we are going to see how homeopathy helps us in dealing with this heel pain, plantar fasciitis or calcaneum spur. Before going to that, let us see what are the causes, or who are the persons in the society or individuals in the society rather who are affected by this heel pain. So usually the job profiles where long standing is required, like our traffic policemen or laborers or teachers who need to stand for long time, or shopkeepers who need to stand for long time, and salesmen and saleswomen who need to walk a long. Now if they stand for long time, because our knee joint and heel pain or heel joint, basically what we say as the ankle joint, is a weight bearing joint. So constant weight on this joint leads to increase in the swelling of the part or break of this band to certain extent, not completely. If this band gets broken or the cells in this band gets broken, that time it leads to inflammation. Okay, so policemen, laborers, shopkeepers, salesmen, saleswomen are usually the sufferers for this type of heel pain or plantar fasciitis. So one of the causes is obesity. Obesity leads to pressure on the joint, and that joint again leads to inflammation of band, and that leads to plantar fasciitis or heel pain. Also it can lead to calcaneum spur. One more reason additional to obesity is wrong footwear. Ill-fitted or wrong footwear leads to inflammation of the joint or the band. Usually in sports person where the joint is exerted a lot, that time it leads to this heel pain. Okay. So let us see what are the other activities which can lead to this pain. Like if we are not in a routine to do these activities, that time we can suffer with heel pain. They are usually hopping, jumping, running, and all of a sudden you start gymming. When you all of a sudden start gymming, that time you are not in a habit to exert the joint, and that again leads to heel pain. Okay, so the day-to-day activity of the person is affected, of the patient is affected. There is disability and dependency. The patient needs to be dependent on certain amount of work on that on other individuals, and the quality of life is also affected. Let us see who are the individuals who are predominantly affected by this heel pain. And usually at the age of 45 to 65, this heel pain is very common, especially in females. It is more common than in males. The one whose body mass index is more than 30, they are going to get affected very easily. The one who is having flat feet or high arches, flat feet or high arches leads to the plantar fasciitis or heel pain. The one who walks barefoot on hard surfaces, the one who walks on barefoot on hard surfaces again leads to the heel pain. And I already told you about ill-fitted shoes or wrong footwear leads to heel pain. Okay. So these are the causes, these are the individuals who are usually affected. Let us see what investigative modalities are available. So primarily examination of the joint is done, and if after giving few painkillers or maybe anti-inflammatory remedies from allopathic system of medicine, if the pain doesn't reduce, the x-ray of both the heel is done, or the sonography of the feet is done, or directly a CT scan is advised to see whether what kind of inflammation or condition is there. Okay. What are the treatment modalities available? What are the treatment modalities available? So treatment available are especially painkillers or anti-inflammatory remedies are there, anti-inflammatory NSAIDs are there. Then there are braces which are given to support the joint. Then some stretching exercise are recommended by physiotherapists to reduce the pain. Basically, oil massage is also done. Then ultrasonic, what you can say, IFT is done for that, and then there is finally surgical treatment. Okay, where the surgery is done either to remove the calcaneum spur if there a spur is giving a problem, or to reduce the inflammation, some type of surgery is done. Now, two things which can be done is change of shoes is very important. Soft sole shoes needs to be used to take over this kind of condition. And secondly, some splints are recommended to sports person usually for few days to use, so that the inflammation reduces and heel pain is taken care of. Okay. So what homeopathy does in heel pain and what we do at our Rajores Homeopathic Clinic. Let us see. So homeopathy first. So you should first meet a homeopath and take his guidance that how he can help you. The approach in homeopathy is very individualistic. According to your cause, according to your body mass index, according to your type of you can say exertion, many remedies can be differentiated or can be given to you to help out with the pain, swelling, stiffness and inflammation of the joint, which leads to heel pain. Okay. So first let us see, the approach is very individualistic. Every patient is different and needs to be treated differently, but it is holistic also. By holistic we mean that when we treat a spur patient or when we treat a heel pain patient, we also consider obesity, we also consider few other ailments from which the patient has suffered, maybe psychotic or somatic, that is maybe mind related or body related. We consider it as a whole while treating with homeopathy. Okay. Now the first part, when the patient comes to us at our clinic, a detailed case taking is being done on what and how things appeared or happened to be with the patient. Then we find out in the case taking what cause is affecting the patient. We try to remove the cause. If we remove the cause, better, the effect of the medicine will be very fast. Okay. Homeopathy usually gives rapid and gentle cure to the patient in heel pain. One question is often asked that is there any medicine to dissolve the spur which is leading to heel pain? So yes, homeopathy is a system where we have medicine prepared naturally, safe and very effective in dissolving the calcaneum spur, or the bony part which is affecting here can be dissolved completely with homeopathic medicine. We should be giving, or we give in our clinic, simultaneous treatment for dissolving and for pain management. So this simultaneous treatment helps the patient more beneficially and more rapidly to get out of this heel pain basically. Okay. And one good thing about homeopathy is that it does not have any side effect, and it's a tailor-made approach according to your cause, according to your constitution. We can give you medicines which will help you in getting relief from this heel pain, plantar fasciitis or calcaneum spur. Sometimes we need to take help of physiotherapy, or we need to take help of regimens like braces, splints or change of shoes in managing the patient. One good thing about homeopathy is that when the patient comes to us and he takes some 2 painkillers, 3 painkillers per day, so our first job or our first role is that pain relief with homeopathy should be done. If this pain relief is done successfully, it reduces the painkiller and so saves the other important organs from such painkillers. So I hope that you like this presentation on heel pain or calcaneum spur or plantar fasciitis. Do like, share and subscribe our video, and hope homeopathy reaches to all classes and masses through our channel Homeopathy First. Thank you.